Greetings, everyone. I am Dr. Diane Mosher and the chair of the Cy Frank Lectureship Advisory Committee, also the Associate Dean of the Indigenous Local Global Health Office at the Cummings School of Medicine, the University of Calgary. With this year's online lecture, I am excited to welcome attendees from across Canada and around the world. So on behalf of the Cy Frank Lectureship Advisory Committee, the Mckay Institute of Bone and Joint Health, Alberta Innovates, and the University of Calgary, I would like to welcome you to the 6th annual Cy Frank Legacy Lectureship and to thank you all for joining us today. The Territorial Lands Acknowledgement is an honest and historically accurate way to recognize the traditional First Nations, Métis, and Inuit territories of a place. Also, it is a nice way to ground everyone who has coming together for a purpose, to acknowledge that this is an important gathering that is happening. So with that background, I would like to acknowledge the traditional territories of the people of Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprised of the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda Nation, including Chiniki, Bearspaw, and Wellesley. That the city of Calgary is also home to the Métis Nation of Alberta, Region 3. Today, I am presenting from the Mckay Institute for Bone and Joint Health in the Cummings School of Medicine. The Mckay Institute for Bone and Joint Health is a multidisciplinary research institute comprised of basic scientists, orthopedic surgeons, rheumatologists, radiologists, kinesiologists, and biomedical engineers, all working together to understand, prevent, diagnose, and develop new treatments for bone and joint conditions. Before we start the webinar, I would like to review a few of the technical pieces for today's webinar and Q&A participation. The chat and the Q&A features are open to everyone in the session, and you can use the chat feature to report any technical issues or send a message to all panelists and attendees. After today's lecture, we will be hosting a Q&A. And the Q&A will ask any questions from the lecture. You can ask the questions throughout the lecture, however, they will not be answered until the end. And only questions that are in the Q&A box will be answered. Before asking a question, you may check to see if someone else has asked the same question, because you can upvote it clicking on the thumbs up icon, and then it makes it more likely that your question would be answered. Note that this lecture is being recorded and can be shared via email to all registered attendees after the event. Now, a few words about Cy Frank and the lectureship. Dr. Cy Frank was an orthopedic surgeon, scientist, longtime faculty member in the Cummings School of Medicine, and one of the founders of the Mckay Institute for Bone and Joint Health. Dr. Frank was internationally known and acclaimed for his visionary efforts to lead and champion the value of multidisciplinary clinical research and the application of his research to innovative solutions for clinical care. At the time of his death in 2015, he was director and CEO of Alberta Innovates Health Solutions. He was known for to be inspiring, empathetic, and a wise leader dedicated to improving the health and well-being of Albertans. Now I'd like to share with you a video created a few years ago, which honors his generosity and showcases his impact on the community.
It's a huge question to ask about Dr. Frank's contributions because they've been many, they've been varied.
Dr. Frank was very integral in orthopedics in Canada and medicine in general.
His innovation in trying to develop new ways to deliver care was of such a great impact on both Alberta orthopedics and Alberta medicine.
Well, I first met Cy in an interview process for the 13 inaugural scientific directors of the Canadian Institutes of Health Research. Everyone assured me that he was a great leader, a great individual, and a great scientist. Cy and I worked closely together for the next 7 years. Me as president of CIHR and him as one of the 13 scientific directors.
I worked for Cy at Alberta Innovates Health Solutions when he joined 2.5 years ago as the CEO.
One of the lasting legacies for Cy, I think, has been the establishment of this Center for Mobility and Joint Health. The Mckay Institute is a big part of that. And what Cy always believed was the power of putting an engineer together with a clinician to have that collaborative environment.
As a researcher, he had the respect of the entire orthopedic research community throughout the world.
One of the great attributes that Cy had was his ability to put it all together, to form a plan, to get people behind that plan, but then to be able to implement the plan. And that is very, very hard.
Engineering, kinesiology, nursing, rehab medicine, the hard sciences, rheumatology, orthopedic surgery. That was all his vision, and he wanted us all mixed up. He was adamant that we had to be all rubbing shoulders day to day in this multidisciplinary group.
Cy really believed that research could inform better clinical care, but he worked in the real world, and he understood how he had to make changes locally, how he had to make changes provincially, how he had to affect change nationally. And that really earned him a reputation in Canada and beyond as somebody who passionately believed in better clinical care for people.
He had a really strong vision around the value of sharing health information and what that could mean for the improvement of providing services to the patient.
He struggled with some of the injury-related things that many of his patients did, and that helped him, I think, identify with patients.
I think that's what really made him who he was and why he has garnered so much respect, is because of that ability to relate to people, no matter their background, no matter where they come from, and be able to bring people together to share ideas. People felt like he was genuinely interested in what they had to say because he was.
The lectureship is intended to promote and to make sure that those enduring qualities that Cy represented are continued even now that he isn't with us.
I think he'd say keep going. You know, he leaves behind a real huge number of champions that are trying to make the world a better place, that are trying to make it better for patients and it better for clinicians.
Upon the passing of Dr. Frank in 2015, the University of Calgary and the Cummings School of Medicine established an endowment to create an annual traveling lectureship to honor Dr. Cy Frank's legacy. The Cy Frank Lectureship was created to showcase the work of individuals who reflect the passion and commitment to health innovation. The lectureship takes place annually in multiple locations. However, this year we are offering the session online only. I'd like to thank the friends, family, and colleagues of Dr. Cy Frank who have contributed to the Dr. Cy Frank Legacy Lectureship Endowment. We continue to welcome donations to ensure the lectureship can be sustainable and have national impact for years to come. If you are touched by Dr. Frank's vision, generosity, we've included a link to the donation page through the chat function, and we greatly appreciate contributions to the lectureship. So it is now my pleasure to introduce the 2021 Dr. Cy Frank Legacy Lecturer, Dr. William Ghali. Dr. Ghali is a world-class researcher and Vice President Research at the University of Calgary. He is Professor of Medicine in the Department of Medicine and Community Health Sciences. Dr. Ghali is also a physician specializing in internal medicine. He completed his MD at the University of Calgary and his FRCPC at Queen's University in Kingston, Ontario. He did further training in health sciences research and epidemiology at Boston University School of Public Health. Dr. Ghali was also the former scientific director of the O'Brien Institute of Public Health at the University of Calgary. He has handled millions of dollars in peer-reviewed research funding from a number of agencies through his research program, focused on evaluating and improving health system performance for better patient outcomes and improved system efficacy. He has held a Tier 2 Canada Research Chair in Health Services Research for 2 5-year periods and has published more than 420 papers in peer-reviewed journals. He is a fellow both of the Canadian Academy of Health Sciences and the Royal Society of Canada. He was featured by the Globe and Mail in April 22 as the Canadian Public Health Researcher with the highest publication H index, and has also been named in the Thomson Reuters listing of the top 1% of most highly cited researchers by discipline. He is co-director of the University of Calgary World Health Organization Collaborating Center in Disease Classification and Health Informatics. So without further ado, I would like to welcome Dr. William Ghali.
Thank you, Diane, for that introduction. Is the sound okay? It's always good to just check that before I talk for too long.
Yes.
Okay, that's good. All right. Well, thank you. I'm very pleased to be here, and it's interesting. During the introductions, I had a chance to look at some of our colleagues who are joining the lecture. So right off the top, a huge thank you for the invitation to be this year's Cy Frank Legacy Lecturer. It's exciting to have a chance. I wish it was in person because many of you would love to catch up with, and I do look forward to a post-COVID time where I can meet up with old friends and really for today, I will say this is the opportunity to talk about the science of impact and research impact assessment is a really exciting one because this is, in many ways, a body of work for which Cy was a national pioneer and international leader in bringing research impact assessment and a mindset for thinking about impact in all that we do. And I think we see that in that video that you showed, Diane. It pays a tribute to Cy, and it really does a tremendous job of describing who he was. Focused on impact, committed to interdisciplinarity, transdisciplinarity, a collaborator, really all of those things. And I know that so many of you are here because of the really tremendous legacy of his life and his work and his scholarship and his leadership. So again, really an honor. I do want to work backward in describing my interactions with Cy by saying that I had a chance to work very closely with Cy and with other colleagues in helping to set up the SPORE support platform in the province of Alberta. I know Pam Valentine, who was in the video, was instrumental, as well as were a number of other people. And that was a $48 million funding envelope that was secured here in Alberta. And that was at a time when Cy was the CEO of Alberta Innovates, and I had a chance to interact with him there. He was also a vice president of research with Alberta Health Services, working alongside our friend Bob Sheldon. And Bob had asked Cy to help Alberta Health Services with its knowledge engagement, knowledge translation, and impact work. And so he was doing exactly what I'm going to be talking about in depth today. In that role, he assumed a seat on the O'Brien Institute's executive committee. So in the early years of the O'Brien Institute, despite all that he does, Cy was so generous with his time, and he advised us in the O'Brien Institute. And one of the things he suggested was that we should make sure we go to the International School for Research Impact Assessment. And Jamie Day, the administrative director of the O'Brien Institute, embraced that recommendation. And you'll see in some of the work that I show, the research impact assessment framework that Cy led in action. He was a CIHR Institute director chosen by our friend Alan Bernstein. And Alan, I see you're attending today, so wonderful to have you here as well. And I had the chance to see Cy when I was quote unquote growing up at the University of Calgary, and then academically in places away from Calgary. I learned from Cy, and way back, I'll just indicate the screen that I even knew Cy back in 1987 when I presented for a medical school interview. So it's interesting that Alan in the video said that he met Cy in an interview process. I also met Cy in an interview process. And in that particular case, it was in the spring of 1987 as I was interviewing for medical school. And that picture looks like it was taken at his old office, which was up on the balcony overlooking the health sciences atrium, the old atrium. And I can tell you that even back then, I could tell that Dr. Frank was very special, because the way he interviewed me and made me feel really comfortable, and it was a conversation. And boy, what a privilege to have known him as far back as then. So with that story of having been interviewed by Cy, I'll just go back to focusing on today, where as I've already said, I'm here talking about Cy's profound contributions in the domain of achieving impact through scholarship, but also research impact assessment. And this is a photo of him speaking at the International School on Research Impact Assessment. That is an entity that Alberta Innovates has been a big part of supporting. So a shout out to Alberta Innovates and some people that I'll mention in a minute. And this particular photo, I guess, was at the 2014 summit that was held in Banff. And some of what Cy was presenting on related to his work with the Canadian Academy of Health Sciences. I will say that in selecting the topic, maybe I'll just back up and just say one more thing, that I did have a chance to speak with Diane and Diane Mosher and Kirsten McGilvery, who has done a huge amount of behind the scenes work for today's lecture. And it was a real pleasure talking about Cy, and I had presented a few possibilities of topics that I might speak about that relate to interactions I've had with Cy. And another area I might have talked about was the strategy for patient-oriented research and our journey there. But at the end of the day, I felt that this particular topic is really a tribute for me to Cy, because he really taught me to think about impact in everything I do. And in many ways, I always consider myself to be in constant ethnography when I interact with people who are tremendous leaders around me. And I just try to look at what are the attributes of a great leader. And I think watching Cy, working with Cy, interacting with him, I saw this dogged commitment, this commitment to hard work, this commitment to people, the commitment to interdisciplinarity, transdisciplinarity, and the commitment to impact. So I just wanted to take that time up front to really pay tribute to a great colleague and a great person and a great leader and a great scholar. In talking about impact, I'll just now shift a little bit now into the content. And so just wanted to start with it's always amusing to pause and say, when we're describing a concept, and I'm involved in my research in disease classification, so I'm very fond of ontologies and thinking about concepts. And so the concept of impact has some definitional elements that are not related to the impact that Cy is talking about, the force or energy or collision of two objects or impact of one thing crashing into another. So that's not what we're talking about. On the other hand, just in terms of the English word impact, a significant or strong influence and effect. And then the second definition in relating to the power of an event idea to produce changes and to move the feeling, etc. So in that, the notion of change, effect, not necessarily always clear whether there's attribution that something has caused an effect. And there is the challenge when we're thinking about impact of causal inferences, and I'm going to come back to that. More focused on impact assessment, there is a definition from the OECD that carefully walks the line of indicating that there can be both positive and negative effects, primary and secondary effects produced by an intervention, directly or indirectly, intended or unintended. And then in the research excellence framework, which is a framework for research impact assessment, there's this definition of an effect on, change or benefit to the economy, society, culture, public policy or services, health, the environmental quality of life beyond academia. And in these definitions, the notion of impact is, of course, beyond simply thinking about academic output measures. And you'll see that as we talk about impact, we're thinking about things beyond the typical measures that we have. To start talking about impact, it is important to first pause and talk about a domain, and it is in fact a scholarly domain and a mindset that is often talked about, that of KT, knowledge translation, knowledge transfer, knowledge engagement, implementation science. And many of you know about the so-called valleys of death. One of our colleagues, a colleague that I have the privilege of working with a lot, Dr. Harold Pincus at Columbia University, has written about these so-called valleys of death. And the notion of KT, knowledge engagement, implementation science, is to think about creating pathways and bridges that can catalyze and enable the movement of science, often from the far left. It's not always from the far left. And I should mention that these particular images are for a health research audience. So there are certainly analogous images that might be in domains such as energy, climate, environmental science, agriculture. So in this particular paradigm, the slides refer to valleys of death for health research. And the idea of knowledge translation and initiatives that advance knowledge engagement are about moving from the left to the right. And the first valley is sometimes, well, it's not always this way, but there's a focus on bridging basic discovery and thinking about translational science that might catalyze the development of new diagnostics, new therapeutics. And in some cases that can involve patents. It can involve licensing agreements with pharmaceutical companies. And then it can involve clinical testing in a clinical arena, looking at different phases of clinical trials. And then when there is efficacy from clinical trials demonstrated through research, there's the second valley that is the challenge of implementation and broad uptake in health systems. And so the ways in which we bridge these two valleys are very different. And these often involve that interdisciplinarity and transdisciplinarity that was talked about at the outset in the presentation from Sai. This is another depiction of much of the same. And I take time to show these because you'll see when we talk about research impact assessment that there are similar left to right progressions as we think about how research produces downstream benefits and ultimately impact. The caveat on all of these slides is that these particular slides are health-focused slides. Not all research and scholarship has to move through these phases or through the preceding peaks and valleys. There is research that can be purely focused on discovery, that can be purely conceptual or theoretical. And not all research has to be about solving a societal issue or a societal problem. However, I think certainly Sai embraced, and a lot of what we do in scholarship does have to be anchored to relevance and what is the downstream implication of what we do. And certainly these I guess you could call them stations in a progression of how science leads to impact are steps that often require a lot of time and a lot of effort and a lot of transdisciplinarity. I think we can look at this and ponder this year and a half of developing COVID vaccines and think about how there's been a lot of forward steps. There are also some iterative and bidirectional steps that are involved. And perhaps at this stage, to some degree, there's work that's being done on the far right that's focused on translating what we know from clinical trials and addressing a population phenomenon of vaccine hesitancy and policies that can advance vaccine uptake. So you can look at this and think about contemporary grand challenges and consider the progression of science to knowledge, knowledge to practice, practice to impact. And this is certainly intertwined with the research impact assessment and the science of impact that I'm now going to pivot to. So on that backdrop of having started with that focus on, I think what you would all agree is a well-accepted and established domain of knowledge translation implementation science, I now want to pivot to the newer emerging science of research impact assessment. And to do that, obviously Cy has been a pioneer through his leadership of the Canadian Academy of Health Sciences research impact assessment work. These three individuals deserve shout outs. So Catherine Graham is a tremendous colleague of ours at Alberta Innovates. So she exemplifies the commitment of Alberta Innovates to impact. And she is a scholar in the domain of research impact assessment, and she has worked with two international leaders, Dr. Jonathan Grant at King's College London and Dr. Paula Adam, who is based in Barcelona, working with the Catalonian government's health agency. And they obtained funding to create the International School for Research Impact Assessment that had its inaugural conference or inaugural school cohort in 2013. And then over a number of years, they've had events where it is exactly that, an international school for research impact assessment. And they really have advanced the science of impact, creating a tremendous set of tremendous toolkit, a lot of resources and repositories of, for example, framework documents. And one of the things that they've done a very nice job of doing is they've effectively articulated, first of all, I would say an upstream question of why do we want to even bother and think about impact and research impact assessment, and they have a delicate, so they have an elegant depiction of the 4 A's of research impact assessment, and I'll say this really speaks to me. 4 arguments for making this a priority in any institution, in any funding agency, in any foundation, and even in anybody who wants to donate any money to anything, is to think about impact. And having a research impact assessment lens can serve an advocacy function. So from the research community side of things, we can make the case for research and investments and funding by pointing to the impacts that our scholarship produces and our institutions produce. It can be very valuable to funders for allocation. And you'll see later on in the talk that the UK is in the very real game of using a mature research impact assessment framework to make allocation decisions based on demonstrated research impact. It's also valuable for accountability. Obviously, when receiving funds, there is accountability to produce impact. And then for institutions and universities and any research organization, analytically, it's valuable to understand how science how science is working and how to shape it. So definitely a compelling set of reasons. And I now wear the hat, as Diane had mentioned, of being the Vice President of Research at the University of Calgary. And we have embraced a number of initiatives relating to research impact assessment, and we want to go deep on being very sophisticated as an institution and committed to being crystal clear on our impact narrative for the reasons that are shown on this slide. Research impact is most powerful when it is well-structured. And in this regard, I allude to the International School for Research Impact Assessment being a very valuable repository. They have some open access, Creative Commons available slide decks. And this is a visual from their library of some leading frameworks for research impact assessment. And I'll just comment on a few of these. The Research Excellence Framework in the UK is a framework that hasn't been in place for already a handful of years, and it is being used currently to assess the performance of universities in the UK to determine funding allocations. So here in Canada, we have a system that some of you may know well, others may not appreciate as well. It's called the RSF, or Research Support Fund, which is a formulaic fund that gives institutions a proportional share of indirect research funding. And that proportional share of indirect funding is linked to how successful the institution is in tri-council funding competitions. So as a vice president of research, I'm now totally on top of our RSF numbers, and we get a funding allocation that's based on our funding success, but it is not based on the impact that those research grant dollars received have produced. Whereas the UK has really made this shift to trying to look at actual impact to determine future funding allocations, not just awarded dollars. So pretty interesting shift, and quite an important shift. In the US, there's a system called STAR metrics that is from the Department of Health and Human Services in the US, and this is about assessing the impact of research. They're not at the point of using it to allocate dollars to institutions, but nevertheless, an interesting system that you can read about. In Australia, there's the ERA system, or Excellence in Research for Australia, that uses a combination of bibliometrics, but also some other quantitative indicators to look at R&D output. And then I won't read this whole list. I'll just stop at telling you there is the notable Canadian Academy of Health Sciences framework that Cy chaired and led, published in 2009. And it is viewed by many as being the most versatile because of its many dimensions and comprehensive. And hopefully the discussion period will allow, because I know some of you in the audience are real experts, we could go deeper on that. It is a sophisticated framework, and it is one that I will show you some examples of its use in action. All of the frameworks have a common feature, because I could sort of get into what are the differences. They dictate the need to explicitly consider institutional inputs. What is being invested? What resources are we working with in our research? Processes. So based on those inputs, what are we doing to accomplish research goals and objectives? And then outputs. What is produced? What are the direct results? And this is often where we stop. You know, we published papers, we got other funding. And then the more downstream questions of what about outcomes and impact? What are the medium and long-term consequences of the activity? And what are the ultimate impacts that are aspired to? So I was, as was mentioned at the outset, the director of the O'Brien Institute for Public Health here at the University of Calgary. And it's very common. It would be very common for us to do research where we did an analysis of costs of a care service, or an economic analysis, and then we shared information with the Ministry of Health or with Alberta Health Services. And in that particular case, I think it would be an example of scholarly work that's pretty good. There's a partnership with health system decision makers. We've shared results with decision makers. We've sent a report to the decision makers, and we've published a paper, and that's actually pretty good. In a research impact assessment framework, though, there's the downstream question of, okay, did the decision makers use the work that was done and the information produced to actually guide decisions? And then downstream from that, did those decisions actually lead to a reduction in a negative health outcome or improvement of health or a reduction of cost? And sometimes we can think about the triple or quadruple aims that we often talk about in healthcare, and really getting to that downstream impact. As an institute director in our medical school, I would be honest and say it's really only a small number of times in any given year, probably that you can count on one hand, that even a big institution like the O'Brien Institute for Public Health would actually get to those downstream impacts of reducing antimicrobial resistant strains, for example, or actually a survival advantage in a particular area. Those downstream impacts are elusive. And I think being aware of that and honest about that is obviously an eye-opening thing, and research impact assessment opens our eyes to that. And probably that's why Cy was never complacent and never resting, because he knew how elusive the downstream impact is. In the research impact assessment frameworks, there's this notion of payback frameworks. And so what does payback look like? Well, it can just be knowledge production from a research activity or capacity building, or informing policy development, or informing product development. Those are those more proximal paybacks. And then the more difficult to achieve downstream paybacks or sectoral benefits for health, education, environment, culture, socioeconomic benefits, artistic or cultural benefits. Certainly, for me, life is a continuing educational journey, and having moved from the medical school and our Institute for Public Health, where I certainly had in that previous role a lot of interaction with scholars who are not in the medical school at the University of Calgary, but becoming vice president of research has opened my eyes and educated me on a number of scholarly domains outside of medicine, very, very far from medicine or public health, where impacts can be in many domains, artistic productions, again, historical inquiry that again is not in a health domain. So research impact assessment frameworks are applicable outside of, we're talking about the Canadian Academy of Health Sciences, but are applicable outside of health. So again, to have a slide on this thing that I've talked about already so much, just to ease into this particular document again. So to reiterate, Cy was the chair of the panel on the return on investments in health research. I think many of you know about the Canadian Academy of Health Sciences as an organization, and this was published in January of 2009. I don't know how long the labor of love was for the panelists to get to the time that this was released. And this is a visual depiction of the framework, and this is a little more complex than that version that I've shown you earlier, which had the four. I'll just back up just for a minute. The four key categories. This has a little bit more, but you can map all of the columns of this figure to those four categories. There's an extra layer on this particular figure, and that is over here on the left. And I'm going to come back to this. This is an arrow that kind of alludes to domains where there's need. There's a societal challenge or a grand challenge. I'm going to say more about what is the impetus for scholarship in a particular area. Clearly, impact is greatest when there is a societal issue or a global issue that requires attention or that requires solutions. for example, like a new viral pathogen that requires vaccines. So that's a first comment to say that distinguishes this. And then here it alludes to the research activity, the partnerships with industry, government, other industries, and then the outputs that are proximal and then more distal. And then the figure has a bidirectional nature, not unlike those knowledge translation conceptual diagrams that I showed at the outset that show how impacts and findings from recent work then feed back to informing future work. And there's again the notion of the partnerships that are so central, the transdisciplinarity. And this is the Canadian Academy of Health Sciences framework presented conceptually. And now to bring it to bring it to life a little bit more, I'll give you the case study of using this framework. And this is, I'm very, very proud of this work because I'm proud of Dr. Jamie Day, our Executive Administrative Director of the O'Brien Institute. As I mentioned, Jamie was a student, I suppose, or a participant in the Banff iteration of the International School for Research Impact Assessment. And she's had a chance to rub shoulders with the likes of Jonathan Grant and Catherine and Paula as leads of the school. This report is a report that gets produced every 2 years, and that may change in the future. I'm no longer the director of the O'Brien Institute. Dr. Tom Stelfox took over that role last year. I'm so excited to see Tom in the role in the O'Brien Institute team continuing this journey of impact. This has been produced for international scientific advisors to the O'Brien Institute and also to the board of the Institute that has constantly been dogged in asking us questions about what we do and why we matter and what impacts matter. So when we would tell the board that we published a paper in the New England Journal of Medicine, they would say, well, why didn't you publish in the Alberta Journal of Medicine? Because they have no knowledge of what the New England Journal of Medicine is. They're interested in knowing, well, what's the impact to communities? And so that kind of community presence on the advisory board of the O'Brien Institute and the international advisors that included colleagues such as Ilse Chernick, Johnny Yanyan, who's now at the University of Michigan, Fred Pacot, who is the head of the Swiss Science Foundation, and others. Certainly advisors like that were really like Cy, very much like Cy, committed to impact and what is the value proposition of the research that you're seeking to do. The vision statement of the Institute declares the vision of the O'Brien Institute is better health and healthcare. So with that kind of declaration, then the research impact assessment framework would dictate that we need to show a demonstration of better health and healthcare. So this was the depiction of the Canadian Academy of Health Sciences framework to that research impact assessment report. And I should mention that you can download that report by just Googling O'Brien Institute Research Impact Assessment, and it is available on the web. Much like the Canadian Academy of Health Sciences framework, there's the explicit consideration of what institute resources are being leveraged. And that can include members, the support team, some dollars from the Institute, the research environment, and in turn, what institute activities do those resources now make possible? And that can include knowledge generation, the doing of research, knowledge translation, network development, partnership building, capacity building through trainees and new faculty. And then what outputs are produced. And those are those proximal products, so publications and new memberships, partnerships, and then to mission and vision, what short-term outcomes do they create? That can include informing decision makers and what are the downstream outcomes in terms of in better health and healthcare, which is back to the vision. And I'm red-green colorblind. It took me about, it took me actually until the third Institute report to understand that Jamie was color coding the pages of the report so that when you're reading a page that has these colors, you're in that section of the report where you're reading about the more downstream things. So a really nice way of organizing the impact. So in terms of Institute resources, and I'm not going to get too granular, but this was a depiction showing that the Institute's core budget for facilitation, enabling activities is only, at that time, was $1.5 million. And that's on the base of a membership that has with infrastructure close to 100 million in value. And then the generation of revenue by this membership, and this was a subset of the membership was there. So this was a depiction, and there's more detail to this, but just showing that there are a lot of resources at play as an institution or an institute like this one undertakes research activities. And then in terms of, I guess this is not really outputs, but this is the success of funding applications. There was a pretty drastic, and this has continued to go up a bit actually, pretty drastic and impressive climb in research funding. And this was really validating of many of the processes that were in place in terms of creating peer review communities, having some empowering seminars where really it was about making people believe in their ideas, believe in their ability to go after applications. And we had really a phenomenon of not so much increasing our success rate. Some of this was about success rate, but basically this is almost a 6-fold increase in funding over time. It probably is 6-fold now. It was, I would say, probably a 4-fold increase in the number of applications, and then some increase in the quality and the rigor of the applications through effective communities of peer review. And what happened over time, this was, I think, I don't remember what year, I think this was in about 2017. So these were the CIHR operating grants secured by the University of Calgary. And back when the Institute started its trajectory, we would have been more to the right of this figure. So quite a climb in Tri-Council funding success. So again, that's not impact. That's just those academic measures that suggest, well, there's some momentum here, but that's not the downstream impact that Sci cared most about. We also were interested in interdisciplinarity and transdisciplinarity. And so this is a visual created by our colleague Jenny Godley, who's a sociologist in our Faculty of Arts and also an Institute member. And Jenny had demonstrated co-authorship social network analysis back in 2009, the year before the Institute launched. And then in 2015, and you can see certainly more collaboration. And it's notable that this collaboration was not just collaboration within our departmental and faculty silos. This is collaboration across faculty and obviously across departmental lines. So exactly the kind of interdisciplinary, transdisciplinary that can produce impact and that can produce, I believe, greater success with Tri-Council funding applications. We know that the Tri-Council agencies are wanting to see this sort of transdisciplinarity. And this is just an updated extension on co-authorship. So though we don't have those beautiful diagrams, I think you can imagine that from 2015 to 2018, there was a further 13% increase in numbers of publications and an increase in the publications per member, and then a 12.5%. So another increase in the co-publications that bridge faculties, departments, and so on. So, and then high researchers with high H-index values increased over time. So really, these are, again, those proximal outputs that speak to an institute on the move, but they don't satisfy our board that's asking, well, what about impacts in community? I will say, though, back to the 4As, clearly people saw this story and said, wow, there's something going on in Calgary. And I had that question many times. And I was chairing a couple of peer review committees over the period when there was that trajectory. And I remember being asked at CIHR, well, why are there so many grants from Calgary? You guys are hitting it out of the park. So it was good on the 4As because people could see there was a seriousness. But it's ultimately about what about the outcomes and what really, and what are the long-term outcomes. So this is where I just shift to talking about societal impact. And it's interesting because one of the big areas that is discussed at the International School for Research Impact Assessment and in the work of Catherine and Jonathan Grant in particular at King's College is the narratives of impact. And usually this is where the methodology changes from graphs and quantitative things like H indices, and it shifts into in-depth stories of how impacts have been achieved. And so this is a sampling. By no means is it a full listing. I have a light that goes off in my office. I need somebody to write a letter to the president here, Ed Mckay, to tell him to fix my light so it doesn't go off and save power here. But I don't know if that is on, but I'll tell him I said that anyway. So the top left is a picture of the Calgary Drop-In Center. So the biggest shelter, social support agency. The KI on the side of the building is like a periodic table, an element in the periodic table of the elements for kindness. And we have in the O'Brien Institute a really exciting program that's focused on social and structural vulnerability. Katrina Mullaney is a tremendous dynamic colleague of ours who leads this particular program. And there have been some exciting projects done out of that program that have focused on mitigating social vulnerability. I can mention one in particular that's co-led by Dr. Gabe Fabro and Dr. Carrie McBrien. And they have looked at a social support and social agency navigation intervention for vulnerable populations, vulnerable individuals who have used hospitals, either emergency rooms or hospital wards very frequently. And this social agency navigation intervention has led to a marked reduction in health system use. So that's a good thing. That's a proximal success. But also a large number of the individuals have been successfully housed and stably housed out of the program. And then there have even been some re-engagement with employment activities for the individuals. So a program that is remarkable. It was funded as a pilot program initially from a foundation, and then it went on to get PRIUS funding from Alberta Innovates, the Partnerships for Research and Innovation in Health Systems. And then there have been some investments made by Alberta Health Services to sustain the program as an ongoing program. I think amazing work, interdisciplinarity, cross-sectoral collaboration. Kudos to all involved. Kudos to the funders who made it possible. Second one is just a depiction of e-health. And I'll just say here that actually my better half, I'm very proud of her, Dr. Doreen Raby, worked with many stakeholders provincially on the development of an e-health policy white paper. And this was focused on looking at e-health systems in Alberta, and the systems in this province are rather advanced on the e-health front, if not the COVID management front. But there was a period of evaluation of elements of our e-health framework, and this policy paper has informed dialogue, decision-making. The O'Brien Institute conducted some policy symposia involving multiple stakeholders. We worked very closely with a patient, a citizens group called Imagine, that was founded by a group of citizens. And Judy Birdsell, I think may be on. I think I saw your name, Judy. So shout out to Judy, who's leading the group. Charlie Fisher was one of the co-founders of the Imagine Citizens Group. Charlie sadly passed away last year, but his legacy, much like Sai's legacy, is in the Imagine project and the e-health innovations that are happening in this province. The third one that I show here is a WHO guideline report, for which the University of Calgary was the evidence providing resource. Herman Barkema is principal investigator of this massive work on looking at agricultural restrictions on antimicrobial use and the extent to which they reduce emergence of antimicrobial strains. The work done by a team of O'Brien Institute researchers led to a number of publications, but more importantly, WHO guidelines that have been adopted in the EU, in large parts of Asia. Really, many countries of the world have followed the guidelines that have arisen out of that O'Brien Institute work. And kudos to Herman. And Herman's a professor in our Faculty of Veterinary Medicine, tremendous colleague and friend. And I should mention actually Dr. Karen Tang as a general internist who did the heaviest lifting in that work in terms of compiling the evidence. And then the last piece I'll mention is we have a WHO collaborating center at the University of Calgary that's focused on health information and disease classifications. Huda Kwan is the director, and suffice it to say that a huge part of ICD-11 comes from ideas and contributions of O'Brien Institute members, and our colleague Danielle Southern, who makes the lives of Huda Kwan and I tolerable because of her tremendous work. She's a big part of this work with the World Health Organization. So really exciting stories of impact. And then I just wanted to mention that in all cases, it's ultimately about qualitative narratives that get into how impact was achieved. And so these are two bodies of work that our colleague Fiona Clement led with her health technology assessment team. One focused on health system savings and pathways for identifying low value interventions in healthcare. So extensive work that she and her team did for the government of Alberta, that the government of British Columbia took note of, and so the health technology assessment led by Fiona was contracted also by BC to do similar work. And then earlier, Fiona had led some work with Rebecca Haynes-Saw in the Institute on informing cannabis policy. And I think that the report that she did was specifically focused on approaches to taxation and again, work that has influenced policy and contributed to decisions. So these narrative stories of impact. And then the last piece in this example is some metrics that get at the extent to which knowledge flows to community stakeholders. So this is some data on the extent to which the O'Brien Institute has appeared in the media. So you can see in 2012, very little, 2017 increasing, and then now it's basically upward of 3 times a day that there would be mentions of work coming out of the Institute. There was a report that the Institute developed in partnership with the Alberta Children's Hospital Research Institute called Raising Canada, that is a policy white paper or policy expose on the suboptimal state of children in Canada. and hugely important that resulted in a presentation to a Senate Committee on the Health and Well-being of Children. And that was our colleague, Amy Metcalf, who did that presentation. So really trying to go as deep as possible on impact. And then this is more frivolous, just some other amusing stories. We actually have a research project out of the O'Brien Institute in partnership with the Libban Cardiovascular Institute that led to a line in a song by the Tragically Hip. Take Forever is the song, and the line is, Calgary to have my heart attack, Calgary, the place to do it, it's a fact. I didn't sing, so you'll be glad, actually, I didn't sing the line, but suffice it to say, that was kind of a neat story, not really serious impact, but cultural impact, perhaps. The Institute also hosted 2 prime ministers with our Chancellor, Deborah Yedlin, for a fascinating discussion. And then back in 2012, the Award of the 21st Century had the privilege of hosting Will and Kate to visit the research center of the W21C. So kind of a, like I say, more frivolous, but nevertheless interesting payback, so to speak, from the scholarship. So as I pivot toward closing, I put up this book, and I think with both Tom Feasby in the audience and my better half Doreen in the audience, I'll say that Tom recommends books to me, and I like that, Tom Feasby. And one of the books that Tom recommended was this book called The Rational Optimist by Matt Ridley. And it's an interesting book. And you know, I'm an optimist in the way I go about life most of the time, except when I'm not optimistic. But I believe in progress. I believe in the relentless progress of humankind and the tendency of humankind to address challenges. And you know, the title sort of tells the story. You can read the book if you want to, or you can just read the title and the cover and you say, oh, that warms my heart. This book talks about relentless progress of humankind, and it talks about the need for specialization in societies, but also the need for transdisciplinarity and the need to respond to grand challenges and the need to be dogged, to the need to get resources in place. But it does lay out how life expectancy, now the pandemic will change this, life expectancy was relentlessly increasing. Large proportions of the world's population had crossed the poverty line over the preceding decade. This is much like the book Factfulness by Hans Rosling. Really a lot of reasons to actually feel good about the world, and science and impact from science is at the core of being rationally optimistic. So thank you, Tom, for the reading. Doreen's comment is, you really need to read some lighter fiction. Tom gives you heavy reading assignments. So nevertheless, I really enjoyed this book. And it's a book that I think really Cy would have loved if he hadn't read it. Part of impact science is having a compass for impact. And by that, I mean a compass for what is societally important. And I think funding agencies get this and review committees get this. Of course, there can be scholarship that's purely about discovery, theorizing, but even then, ultimately, it's important to say for what or to what end. And I just want to pause and say, and this is, you know, I'm now wearing this hat of a vice president research. And one thing that again captures my heart and my imagination is the Sustainable Development Goals. And when travel is all possible, if I'm sure some of you have visited the United Nations headquarters in New York City or World Health Organization headquarters in Geneva, both of those locales have displays of the Sustainable Development Goals. And when I went to the UN headquarters in New York and I saw the mosaic of the Sustainable Development Goals, it actually makes me emotional to think that, because you can look at this and say, this is a compass for thinking about our scholarship. And obviously these are broad notions, good health and well-being. Well, there's so many dimensions to that: quality education, gender equality. All of these are agnostic to discipline, because all of these sustainable development goals require an all hands on deck approach to scholarship. Sustainable cities and communities. We have an initiative in Calgary called the Urban Alliance, and we have a program called Make Calgary that's focused on healthy cities, cities that mitigate social vulnerability, cities that are vibrant and leisure-filled, cities that are green and clean. By clean, I mean non-emitting, emissions. Nobody can argue with the merit of these, and scholarship that starts from these sustainable development goals is likely to be impactful. If you want to be narrower or more discipline focused, you can have a grand challenges mindset. This particular exhibit is grand challenges for engineers. And again, kind of interesting: engineering better medicines, providing access to clean water, making solar energy economical, advancing health informatics, et cetera, et cetera. So again, interesting ways of thinking. And I think scholarship that begins with this sort of thinking is going to be more impactful. And it might, in between the idea and the impact, it might be more fundable too. And then here's another one in terms of aging, grand challenges for aging. So this isn't linked to discipline. This is linked to a reality: aging populations and aging individuals. And then here, some grand challenges that can be a way of thinking about prioritizing. So just as I close, I'll just say that the University of Calgary, we really are embracing research impact assessment. And we're doing so by investing in people. So we have hired some team members, and we have a new knowledge engagement unit launched in 2018. Penny Pexman is the Associate Vice President of Research who led the process of launching the unit. We have a dynamic colleague named McKinley Darlington who has led the research impact, the knowledge engagement team. And then research impact assessment has been embraced by the knowledge engagement team. We have signed the San Francisco Declaration on Research Assessment, or DORA. You can't just Google DORA because you'll get Dora the Explorer. You have to write San Francisco DORA to read about DORA. And I'll say a few words. We have a set of knowledge impact assessment tools. And then we have a membership now as a university with Research Impact Canada. And we have kidnapped, she doesn't quite know it yet, enlisted Catherine Graham to work with us in working longitudinally over the coming year in really ramping up research impact assessment and socializing it with all our leaders in the institution and with our research community and with the community that we serve. On DORA, maybe I won't spend much time because I'm a couple minutes past. I'll just say the big thing about the declaration is it really embraces notions of research impact assessment. It recommends a de-emphasis of traditional bibliometrics, traditional measures of impact to try to get more at the downstream impact. It has a little bit of an inward focus because there's a big component that's about how faculty members are judged in terms of merit, promotion, tenure. So there's a little bit of how the badges are given out internally, whereas the Canadian Academy of Health Sciences is how we are accountable to external audiences. Nevertheless, DORA is very complementary to the CAS, or the Canadian Academy of Health Sciences framework, and I think a declaration that we feel good about signing. And I should mention special thank you to Cello Tinelli. Cello is on the governing council at CIHR. I know CIHR is signatory to DORA. Dora, and Cello did the work of socializing this and bringing this through the university's governance committees for ultimate university signature. I'm going to skip these slides. Well, actually, I'll just say this. The big thing is that the declaration is fairly concrete with some recommendations for funders, for research institutions, for journal publishers, on metrics to use, and for researchers. So it's a nice compartmentalization of the implications of signing DORA is that you need to do some things. So we will spend time with our institute directors here at the University of Calgary on what signing DORA actually means. I'll skip that. I hate it when I'm in a presentation and the speaker whips through his thing. You can just look at this. This is on the DORA website, some design principles for institutions to think about. Very nice materials. The DORA website is very good. Just make sure you don't go to Dora the Explorer. So just to finish, I'm just going to run a video that's 2 minutes long. A special thank you to McKinley Darlington and her team for creating this video. You guys are going to think it's weird that the speaker puts on a video that features himself talking, and it's not meant to be self-indulgent in putting me on to hear myself talk, but it's a nice sort of infomercial on research impact assessment, and this will be the wrap on my talk, and I'll just close with some thank yous. So go ahead and run the video. Thanks. Research is really at the core of humankind. Research is about discovery. Research is about creation. Impact is the ultimate outcome arising from research. Many would say that impact is making a difference in the communities we serve, supporting engaged scholarship from inception to impact. And when we do that, we can make research useful and meaningful to society and meaningful to our community. This means we're taking on a challenge to adopt frameworks, adopt methodologies for research impact assessment, and then getting into the habit of reporting in meaningful ways on impact. It's a collective journey because the reporting will begin at the level of individual researchers, research units. It will involve community partners that we're engaged with. It will involve dialogue with community. What does the community want to know? What is the community's expectation on our reporting as a research-intensive university? That's our accountability to report on that. And that's a journey. That's a journey to do that well, to do that meaningfully. So the Knowledge Engagement Unit is there to help tell a knowledge engagement and impact story. And we're trying to set the stage for a dynamic and reciprocal process of meaningful and deep community partnerships. We've talked the talk, now we have to walk the walk. The university is here. It's not just an institution that bestows degrees that helps people get jobs. It's an institution that's here to serve community. And so when there are challenges, the University of Calgary can be a go-to entity. We want the community to know that the university is here to serve. And I think knowledge engagement ultimately helps to achieve that. So thanks for running that. And just as I end and say thank yous, I think the biggest thing is thank you, Sai, for the body of work, for being a role model, for letting me get into medical school. I should have that one too. But no, most importantly, for your body of work, your commitment to impact the Canadian Academy of Health Sciences framework, the investments at Alberta Innovates that have gone into supporting ISRIA. We're lucky. We're so lucky at the University of Calgary to have had you here. And thank you to the Mckay Institute, Alberta Innovates, and the Cummings School of Medicine for this lecture. And I'm really honored to have had the opportunity to speak. So over to you, Diane. Thank you.
Thank you, Bill, for this very informative and inspiring talk. I think it gave us the opportunity all to reflect on what we do and how do we actually measure impact, and are we making an impact? Cy had me co-lead and lead a very difficult group of stakeholders from all across the country. And I said, well, how can I be successful? And his advice was persistence. So I think that's always stuck with me, persistence at any problem that we have to tackle. So thank you, Bill. Now, we have about 20 minutes to answer questions, and we may not be able to get through all the questions because we intend to finish at 5:30. So if you would like to ask any questions, please do so on the Q&A. If someone's already asked the question that you want to have answered, use the thumbs up icon so that it will get more pushed towards the front. So that to facilitate the Q&A process, I'd like to welcome Dr. Stephen Boyd, who's director of the Mckay Institute for Bone and Joint Health and professor in the Department of Radiology at the Cummings School of Medicine and joint appointment with Schulich Engineering and Faculty of Kinesiology, as well as Dr. Martin Ferguson Pell, who's professor of Faculty of Rehabilitation Medicine at the University of Alberta and who is the executive director of the Alberta Bone and Joint Health Institute. I will have them start to moderate the session. Thank you.
Great. So thanks very much. Thanks for a great talk, Bill. And I'm going to start out by reading the questions, starting from the top. First off, this question is from Jeffrey Mogul. For outcomes, you had data. For impact, you switched to anecdotes. And this is why many of us distrust the whole concept of quote unquote research impact. How do we compare impacts except by comparing how compelling the narratives are? Because a more compelling narrative is either a better outcome or a better PR exercise. If we can distinguish between the two, how and why could we possibly use this to guide decisions? So I'll hope that kicks you off, Bill, too.
No. I mean, so I think the first thing to say is that the downstream, the ultimate impact is often, first of all, it's actually elusive and difficult to achieve. So the honest answer is, for a major, let's take an institution like the University of Toronto. Well, there's a story of insulin. So there's the story of insulin, and so that's definitely impact, and that's downstream. And then we're still counting, in terms of the impact of people who have been saved by insulin, because but the truth is that the first part of the answer to your question, Jeffrey, is that it's elusive, and it's not often. You're not counting on much more than one hand the number of things that even a large institution or a large institute would do in a given year. For the examples, because I mean there is in the materials from the International School for Research Impact Assessment, by necessity, the downstream descriptions of impact do require qualitative descriptions, and mixed method scientists would push back a little bit on the notion that qualitative descriptions don't matter. No, qualitative descriptions are often where you understand the nuance. So I think that's a big piece to say. There are some numbers behind some of those. So for the drop-in center, the social vulnerability work, there are actual data and statistically significant decreases in the resource use, and then there are actual numbers of out of the clients in the program, the proportion who are successfully housed and stably housed. So there are numbers. Similarly, for the antimicrobial resistance work, there are numbers on the proportion the proportion of countries that have adopted the guidelines and followed within the guidelines. So perhaps send me an email after the fact, and happy to provide more of that. So
I'll pick the next one up, Bill, and thank you so much for a really fabulous talk. And I was just writing screeds of notes based on what you were saying. And one of the comments that we have is from Mark Fritzler, and I'm going to summarize a little bit because he actually broke it into two sections. And this is the primary question, I think, and that is, there seems to be a disconnect between research outcomes articulated by the Canadian Academy of Health Sciences and the O'Brien Institute, and then other academic assumptions, and what at least one of our major investors, the provincial and federal government, is expecting. And he believes that this disconnect is a major reason that the AFMA, Alberta Innovates Health Solutions Endowment, was repurposed. So I guess what he's really saying is there's a kind of disconnect between maybe the academic framework and the political framework. And how do you see that in terms of how that's affected funding policy?
Yeah. So first of all, just a shout out to Marv. I mean, Marv is has been such an inspiring leader of science in this province, nationally, internationally. And Marv has been part of the provincial, was on the board. Or I don't want to misstate your role, Marv, but I believe you're on the board that advised government on AREF, the Alberta Research and Innovation Framework. And I think what you're getting at is ultimately, did it fall short? Well, it turns out that the provincial government is just now and is bringing to cabinet later this month something called ATIS, A-T-I-S, which is the Alberta Technology and Innovation ATIS, A-T-I-S. You guys can Google it. I guess I just don't want to. I don't want to misstate. And so a team in the Ministry of Jobs, Economy and Innovation is working on it, and they're trying to learn from AREF and build on what we need to actually have impact from investments in research and in post-secondary education. One of the big things that I wanted to see, and big feedback, and I was in a feedback session on ATIS just last week, is I said that having some anchoring in grand challenges and or sustainable development goals thinking would be an element that would perhaps help, because it's about really going where the need is and making research investments and government investments in areas that really matter. So anyhow, I don't know, Marv, I may not have fully answered your question. I know you're going to be in the post-open session meeting. So I look forward to going deeper on that.
Great, that's great. I'm going to take this next question. It's from Deborah Marshall. So Deborah says, thanks, Bill and the O'Brien Institute for Public Health for all the impactful work that has been done, with much more to come. How can we better align performance metrics for academics to recognize impact? Impact is typically achieved through interdisciplinary teams, and this does not always align well with the more traditional metrics. So,
yeah, no, so thank you, Deborah. Nice to see you or have you here. And Deborah is a colleague who's really doing such a fascinating mix of work where for example, working on patient engagement programs and training patient researchers and doing economic studies, does tremendous work in precision medicine for cancer. So Deborah, it's great to have you here. So I alluded very quickly when I rushed through the DORA piece to say that signing DORA was as much about the Vice President Research Office embracing it as it was the Provost and Vice President Academic embracing it. And so we signed DORA when Drew Marshall was Provost, and working with Florentine Strepnik, Francine Smith, and the group who developed the Faculty Promotions Handbook. If you look at the new handbook that the University of Calgary has, it's very explicit in the diversity of outputs that matter, and very progressive, I feel. Still looks for traditional outputs, but puts explicit and increased recognition and value on different types of outputs that may not have traditionally been recognized in sort of older rear view mirror approaches to rewards.
Thank you, Bill. Nishan Sharma has asked this question. The World Health Organization is trying to measure the impact of the guidance documents that have been issued in the last 18 months regarding COVID. They're citing how these have guided policy. But what else would you suggest the WHO tries to measure? So many guidelines, so many jurisdictions.
So I'll start by just saying thank you, Nishan. And Nishan is involved in the work of the WHO Collaborating Center of the University of Calgary. He went over to Geneva and did some work there. And he represented our university extremely well. And they like him so much, they keep giving him consulting jobs on the side. So Nishan does us proud. For the WHO, boy, it's hard right now. COVID is a confusing time, and there's going to be a lot to write and talk about because, what would people say if we were having a casual chat about WHO guidelines and COVID? Well, people have really pointed to things like the airborne versus aerosol thing, or the declaration in January of 2020 that, quote unquote, we have no evidence of human to human transmission at this time, et cetera. Well, of course, hindsight is 2020. But to your question, boy, I'd almost have to take that one offline, Nishan. I have given, one of my favorite topics is epistemology and the science of knowledge. And there's a lot of epistemology to discuss and debate around things like that. I think for that WHO guideline on antimicrobial resistance, very interesting. It has had impact. It was less controversial than some of the COVID things, though I will mention that the Trump administration actually rejected the WHO guideline when it first came out because those guidelines reduce profit in the agricultural food production sector, and they were not popular in the US. I think it's since evolved and there is uptake of the WHO recommendations, but it wasn't an entirely apolitical situation. So suffice it to say, I love the WHO. Other people criticize the WHO. It's not easy to be the WHO in a divided, complex world.
Great, thanks. This question is from Catherine Hankins, who is from the class of 1976, the Beavers, a fellow student with Cy. So I'm not quite sure the Beavers, but maybe you know, Bill.
I know all about these things.
Okay, but she says, thank you for a wide-ranging discussion of scientific knowledge translation. Encouraging researchers to engage stakeholders, including community stakeholders, from the design phase continues to be a challenge. She's wondering, what ideas do you have for making this scientific behavior the norm?
Yeah.
Maybe you could comment on what the Beavers are first.
Yeah, well, the Beavers just the class of 1976, and I was a panda. So I was a panda, very cute furry creatures that everybody loves and thinks are so amazing and exotic. So anyways, yes, I was a panda. So thanks for the question. I will tell you that partnerships are at the foundation, are really crucial for research. There are different kinds of research. Now, I have to disclose, okay, I'm a health services researcher, Pillar 3 health researcher, population health. I think much of what I'm about to say would apply as well. In the O'Brien Institute for Public Health, I would have said, while we all, and I used to be a researcher that used to love my office with the door closed and I could just get work done and get writing done. But public health, emphasis on public, involves engagement with community. And it's amazing how being at tables where dialogue is happening becomes the starting point. And it's almost like what I talked about, the compass of what's important. It unlocks everything. And it's almost like, it's like leaning back when you're rock climbing. You lean back, it's easier, and you realize, it's easier. So if you engage with communities and you take time for partnerships, when you write your grant and say in the first sentence, working in partnership with the Ministry of Health, we are addressing this pressing need of the ministry, and we've done some preliminary work, and now we're going to CIHR for $800,000 of funding. That grant has a high score potential right out of the gates, much higher than the grant that's cooked up by the researcher that doesn't have a basis in need. And for basic science researchers, if the scholarship has the pathway across Valley One, the pathway to bioinnovation, biomanufacturing. Many of you will have noticed the federal budget, massive investments in bioinnovation, biomanufacturing. Maybe not massive, probably Alan would say insufficient, but a start. What we need in Canada, having those pathways and the partnerships to support them. So great comment from a beaver. Thank you for honoring Cy in that way as well.
So what I'll do is combine two questions together because I think that they cover a similar topic, and that is from Jenny Godley and Carolyn Godet. And this is to do with the interdisciplinarity of assessing impact, in that there's a tendency for us to measure traditional impact in a very disciplinary way. And Carolyn makes the point that how do we parcel out what we've contributed? And I think what that means is parcel it out across maybe multiple stakeholders.
Yeah. And I wonder, is there a layer in that question, Martin, that talks about also, to the extent that teams are diverse, there's even credit within teams? Is that a dimension of the question, or is
it's
it
not
more
stated, but I suspect that is part of the question. Absolutely. Yeah.
Well, the first part, like just that piece about credit within teams, sometimes like I think take great pride in even being a small part of a big thing. And I've had some experiences in my life where I was part of the Canadian Adverse Events Study that was co-led by Ross Baker and Peter Norton were the principal investigators, and I was a site investigator, and that was a really important study that got at the problem of suboptimal safety in Canadian hospitals and patient safety. And so just being a small part of a big thing is kind of important, and that's that interdisciplinary teams. For the science of impact, I feel, and I know that Catherine Graham and Jonathan Grant and Paula Adam would say, it is a highly, highly interdisciplinary scientific domain that requires expertise in policy, expertise in communications, qualitative methodologies, quantitative methodologies, whole bunch of things. And we see that with implementation science, where implementation scientists are a diverse group that include, for example, Ian Graham, who's a sociologist at the University of Ottawa, Sharon Strauss, who's an internal medicine physician, but also health systems researcher at University of Toronto. So diversity of scholars are part of the science of impact as well, I would say. And Jenny Godley, by virtue of that work that she did on that social network analysis of co-authorship, is an impact scientist. She just doesn't know it yet. So.
Thank you again, Dr. Ghali. So on behalf of our advisory committee, the Mckay Institute, Bone and Joint Health, Alberta Innovates, and the University of Calgary, I'd like to thank you for being this year's Legacy Lecturer. I'd also like to thank everyone who attended this year's online lecture, and it was great to be able to share this event for people across the country and beyond. Again, it came up in some of the questions. Note that you will receive a recording of today's lecture and an event survey by email in the next few days. So we sincerely hope you enjoyed this year's lecture and the discussion, and everyone have a wonderful evening. Bye-bye.